Hi, I'm going to go ahead and do hand hygiene. And then I am going to introduce myself to the patient. I'm going to verify his identity. He verifies his first and last name and his date of birth from his name tag, and I am going to let him know that I'm going to be giving him IV fluids. He's a little dehydrated. I ask if he has any allergies. He confirms he does not. Once I have done that, I am going to do a third check on my medication. I'm going to verify that the normal saline is actually in order that he needs and the time that he's supposed to receive it. And then I am going to grab a flush and a alcohol wipe. I'm going to check the IV site for redness and swelling. Once I verify that everything is good, there's no redness, no swelling, I'm going to clean his port for 15 seconds, and then I'm going to attach the saline flush. And then I'm going to make sure that his line is open. I'm going to aspirate to make sure blood returns. If he's had fluid recently, he probably won't have blood return. And then I'm going to push about 5 milliliters slowly to make sure there's patency. I'm going to leave that on there for positive pressure. And then I am going to grab and open my IV tubing. I'm going to lock the tubing so that it is not flowing openly. And then I am going to spike the bag.
Because we were all sharing. And then this is like
I'm going to hang the bag.
like
I'm going to prime the chamber, the drip chamber, and then over the trash can I am going to flush. I'm going to prime the line with fluid. And then, once I see that that's done, I'm going to go through the line and verify there are no bubbles. And if I see bubbles, I am going to work them out of the line. Now, if I see they're worked out of the line, I'm going to attach this to the machine. I am going to remove the saline syringe, and I am going to attach the IV line. Now that I have that attached, I can turn on the machine to get him to get it moving. If he has already received fluid through this pump, I can say no, he's not a new patient. If he is a new patient, I have to go through and I have to put in his MRN number. He is not a new patient. His data is already in the pump, so I'm going to say no. We're going to verify that he is a med-surg patient. I'm going to select the channel that the IV is hooked up to. I'm going to select guardrail IV fluids. I'm going to find normal saline, which is what is on his MAR, and then I'm going to confirm with the bag that that is actually what I'm going to be starting his IV with. The rate on his MAR is 100 milliliters per hour, and this is a 500 milliliter bag. And we're going to start. I'm going to follow the line, and I'm going to unhook it so that the channel starts, and then we're going to wait to watch for it to drip. Once we see the first drip, we're able to put the date, 25, and then put initials, and then I'm going to put it on there. If it has a air in the line, we're going to pause it, troubleshoot it.
And I really like the that's going to be our indicator every time we try.
And we're going to restart.
It's so much fun.
And then am going to put this on the line. Now that we have dated that, we are going to move on to the second. We're going to do the IV piggyback. We are going to do cefalozolin. And I am going to verify that, just let him know what's going on. I'm also going to be picking up a IV piggyback of antibiotics. You have a UTI from the Foley that you've been using. So we're going to make sure now that we've got it all cleaned out and changed out, we're going to get you set up on some antibiotics. And then I am going to, one more time, do a third check since I did the first and two at the MAR. And I'm going to verify that cefalozolin is what he's being given. And then I am going to open the new line, IV tubing, and then I'm going to grab alcohol pad because it's getting hooked up to the back of the line. I am going to spike the cephalosome and I'm going to hang it. I'm going to grab the extender for the saline. So that it's lower than the antibiotic. Once I have that hooked up, I'm going to prime
Every day you have a different beach or hike or
the chamber. And then, because it's medication, I'm going to go very slowly when I prime this so that I know that it does not waste any medication if I can help it. And I'm going to be doing this over the trash can if possible.
for sure. I know, I think we were gonna go to Hawaii, but
And then I'm going to, once I have it out, I am going to clean the port for 15 seconds, attach it. I am going to set the channel again, do a secondary, find the antibiotic that I'm going to use. The rate that I want to use is 1 gram per 100 milliliters per the MAR. I'm going to verify that that's what I'm giving. I'm going to hit next, and then I'm going to start. Once I have that done, I'm going to release the second line. And it should be dripping. All right. And then once I have that done, I can date it and I can initial it. And then I'm going to attach it to the secondary tubing. All right. And then I'm going to let him know that it's really common to feel nauseated, maybe have some vomiting or diarrhea. Please use your call line if that happens, so that we can help you get that cleared up, and we can let the doctor know that you're having those effects. Okay? All right, and have a great day.